Hello, my name is Matt Waits. I'm a consultant orthopaedic surgeon specialising in hip and knee surgery. Along with my consultant colleagues, I cover trauma on call and consult in weekly fracture clinics. I'm here to tell you about our virtual fracture clinic, which is an innovative, patient-focused means of looking after people with soft tissue and bony injuries. It's designed to provide a more effective and efficient way of treating people. What is a virtual fracture clinic? For many years, almost all people with soft tissue or bony injuries attending A&E were referred to the fracture clinic. Often, clinics were so busy that people weren't seen for a week or more after their injury, frequently having to wait a couple of hours in crowded waiting rooms before being seen. Now, an experienced orthopaedic surgeon will review your A&E notes and X-rays 24 to 72 hours after your injury and make a diagnosis and treatment plan. You'll be telephoned by an orthopaedic practitioner who will explain the diagnosis and treatment. How does it work? After being seen in the emergency department or minor injuries centre, you leave with a virtual clinic appointment time. It is vital you leave us with a telephone contact number on which you can be reached over the next 24 to 72 hours. Every morning, an experienced orthopaedic surgeon reviews the referrals from the emergency department and accompanying X-rays. Working alongside an orthopaedic practitioner, a diagnosis and treatment plan is established for each person. When all the notes and X-rays have been reviewed, you will receive a telephone call explaining your diagnosis, recommended treatment and rehabilitation for your injury. In the case of many small fractures or sprains or soft tissue injuries, time and activity modification may be all that is needed. This is explained in the phone call and often supplemented with an advice sheet along with the orthopaedic surgeon's letter that you will receive by post. It is important to note that the call from the clinic may register as a no-caller ID, but it is important that you anticipate this and take the call. Why virtual? There are a number of advantages to this. As outlined before, fracture clinics were becoming busier and busier, with people being seen a number of days or even a week after their injury, often having to wait in crowded waiting rooms for a long time to be seen. With advances in information technology, X-rays can be viewed in high definition and notes reviewed digitally the day after you attend the emergency department. This means that you receive a phone call very soon after a senior orthopaedic surgeon has reviewed your case and your diagnosis and treatment is explained. In many cases, these injuries can be self-managed, saving you a needless journey to the hospital. It also means that if your injury requires a scan, this can be arranged without you having to come to the hospital first. In some cases, you may benefit by seeing a specific specialist surgeon. Again, this can be arranged through the virtual clinic so that when you do come to the hospital, you will have had all the appropriate imaging and be seen by the specialist for your specific injury. What if a patient has a question or concern after the initial call? All patients are given the virtual fracture clinic phone number and email when they leave the emergency department and are encouraged to call or email if they have any concerns. These contact details are also included on our injury information leaflets and the orthopaedic surgeon's letter of correspondence.